In this lecture, we are going to continue our discussion of disorders featuring somatic symptoms. There's two topics that we are going to focus on today. The first is illness anxiety disorder, and then we're going to talk about what was previously known as the psychophysiological disorders. So, our essential question for today, something I want you to think about as we progress through this lecture, is what resources can health providers give clients in an attempt to reduce psychophysiological disorders? Let's get started. Let's begin with illness anxiety disorder. So this disorder was previously known as hypochondriasis, and individuals with this disorder have chronic anxious thoughts about their health, and they are constantly concerned that they are going to develop or that they are developing a serious medical illness, even if there are no somatic symptoms present. So some of the things that these individuals will do include constantly checking their bodies for signs of illness. Oftentimes they misinterpret everyday normal bodily sensations and symptoms as a sign of serious illness. So for example, maybe you were outside and the neighbor was cutting the grass, and just through the process of inhaling, some particles got up in your nose and you sneezed, okay, which is the body's normal reaction. Sometimes when pollen and stuff gets in our nose, we sneeze. But somebody who has this disorder may look at it like the sneeze is a sign that there is a bigger problem happening. Other types of normal bodily changes that the individual may focus on include coughing, sweating, and maybe cuts or not little cuts, but rashes and things like that. So oftentimes these individuals may not recognize that their concerns are excessive. Some do. Okay, this is a disorder that can happen at any age, but most frequently we see it start in early adulthood, and it does occur equally in men and women, and it's estimated that about 1 to 5% of all people have illness anxiety disorder at some point. And for a lot of the patients, the intensity of the disorder will fluctuate over the years they have it. So where does this disorder come from? There's a couple of different things. We'll start with the behaviorists. The behaviorists say that the fears that the individual has about acquiring an illness are actually obtained through classical conditioning or modeling. So they use the classical conditioning model to explain it. The cognitive theorists believe that individuals with this disorder are extremely sensitive to and threatened to their bodily cues, that they misinterpret them. So that's where that faulty thinking comes into play. So for treatment, what we'll see is a lot of times individuals with illness anxiety disorder do respond well to the types of treatments that individuals with obsessive compulsive disorder respond to, and those include antidepressant medications, ERP, which if you recall is exposure and response prevention, and cognitive interventions. So the next category that I want to discuss are psychophysiological disorders, which is now known as psychological factors affecting other medical conditions. About 85 years ago, clinicians first identified a group of different types of physical illnesses that seemed to be a result from an interaction of biological, psychological, and sociocultural factors. In the early editions of the DSM, these illnesses were labeled as psychophysiological or psychosomatic disorders. and currently the DSM-5 labels these disorders as psychological factors affecting a medical condition. Before the 1970s, the most common of these disorders included the ones that I have listed here. Current research shows that there are many other physical illnesses that can be caused by both psychosocial and physical factors. So I'm going to go through each of these very briefly. Ulcers are lesions in the wall of the stomach, and actually I have a picture up here of a fake stomach and what an ulcer would look like. So when somebody has an ulcer, they will have burning sensations and pain. A lot of times they may vomit, or they can have bleeding in the stomach. About 25 million people have an ulcer at some point in their lives. The psychosocial factors that contribute to the development of an ulcer include environmental pressures and intense feelings of anger or stress. Now, these can also be caused by physiological factors such as bacterial infections. The second one that I have up here is asthma. And asthma is a narrowing of the airways that makes it difficult for the individual to breathe. About 25 million people in the United States are diagnosed with asthma. Most are children and young adolescents, the first time they have an asthma attack. And there are a number of different causes for asthma, including psychosocial factors such as environmental pressures or anxiety. But asthma can also be caused by physiological factors such as allergies, a slow-acting sympathetic nervous system, or a suppressed or weakened respiratory system. And then insomnia. Okay, this is where the individual has difficulty falling asleep or staying asleep. About 10% of the population has insomnia that can last for months or years. Insomnia can be caused psychosocially by high levels of anxiety or depression. And I don't know if you're starting to see a pattern here with the psychosocial factors, but insomnia can also be caused by physiological factors such as an overactive arousal system and other medical conditions. Next, we have chronic headaches. A chronic headache is defined as frequent intense aches of the head or neck that are not caused by another physical disorder. What's described as a tension headache affects about 45 million individuals a year. A tension headache is not the same as a migraine headache. A migraine headache is much more severe, where oftentimes the individual will get sick, cannot be in bright lights, and oftentimes has to stay in bed. And migraines affect 23 million Americans a year. So these chronic headaches can be caused, again, psychosocially by environmental pressures, anxiety, as well as general feelings of helplessness, anger, and depression. Physiologically, chronic headaches are caused by abnormal serotonin activity, vascular problems, and muscle weakness. Next, we have hypertension. So hypertension is chronic high blood pressure, and usually there's a few symptoms that you can notice just by, well, you can't tell by looking at the individual, but unlike the chronic headaches or the ulcers where there's other physical symptoms, with hypertension, a lot of times the individual doesn't know they have it until they get their blood pressure measured. So this affects 75 million Americans a year. And hypertension can be caused psychosocially by constant stress, environmental danger, and general feelings of anger or depression. Physiological factors, and the biggest one is obesity, followed by smoking. Now, about 10% of the cases of hypertension are caused by physiological factors alone. And then the last one that I have up here is coronary heart disease. So this is caused by a blocking of the coronary arteries. And this term is a collective term that can include myocardial infarctions, which is the medical name for a heart attack. About 18 million people in the United States have some form of coronary heart disease, and it is the leading cause of death among Americans for both men and women. Psychosocially, this can be caused by job stress, high levels of anger or depression, and physiologically, it can be caused by obesity, smoking, high blood pressure, high levels of cholesterol, and lack of exercise. So for that one, I don't know if you're thinking, but if you are, these are related to lifestyle factors. So if the individual made some lifestyle adjustments, then they can reduce their risk for coronary heart disease. So there's a number of different explanations for the causes of psychophysiological disorders. And the biological explanation is that there are defects in the autonomic nervous system that are believed to contribute to the development of these disorders. And the biological model also addresses more specific biological problems. So for example, somebody who has a weakened gastrointestinal system may have a predisposition to developing ulcers. The psychological model says that certain needs, attitudes, and emotions or coping skills may cause the individual to overreact more than once, so repeatedly overreacting to stressors, which can increase their likelihood of developing one of these disorders. So, for example, somebody who has a type A personality style, which is related to a sense of hostility and time urgency, would be more likely to develop one of these disorders. And then finally, the sociocultural model says that the adverse social conditions that an individual finds themselves living in may predispose them for psychophysiological disorders. So one of the most adverse social conditions somebody can be a part of is poverty. And we do know that some of the rates for some of these are higher in low socioeconomic groups than in others. Now let's take a look at the newer psychophysiological disorders. And the question that has come up is, are physical illnesses related to stress? In 1967, the Social Readjustment Rating Scale was developed, and this helped researchers take a look at the relationship between life stress and the onset of illness. So using this assessment tool in a number of different studies, researchers have found that stresses of all different types can lead to a wide range of physical conditions. So for the most part, the greater the amount of life stress, the greater the likelihood one will develop an illness. There's even a relationship between traumatic stress and death. Now, this isn't a perfect tool, but it is what we have. So for example, one of the biggest criticisms of the Social Readjustment Rating Scale is that it doesn't take into consideration the particular stress responses of specific populations. So certain ethnic groups may respond to stress differently. Men and women certainly respond to stress differently. So these have not been addressed by the scale. Another area that researchers have been taking a look at is the immune system. And researchers have found that the immune system is a key to the relationship between stress and infection. So this area of study is referred to as psychoneuroimmunology. The field of psychoneuroimmunology studies how the immune system, the neurological system, and the body's psyche or cognitive interactions all work together. Now, the immune system is the body's network of activities and the cells that are used to identify and destroy different types of foreign invaders and cancer cells. So this can include different types of bacteria and viruses as well. So the most important cells in the immune system are the lymphocytes, lymphocytes. Lymphocytes are white blood cells that circulate throughout the bloodstream and attack different types of invaders. There are different types of lymphocytes such as T cells, natural killer T cells, and B cells. Stress interferes with the activity of the lymphocytes, slowing them down, which means that the individual's susceptibility to developing viral and bacterial infections will increase. And there are a lot of different factors that influence whether or not stress will behave in this way in the individual. And these include biochemical activity. So we do know that stress leads to an increased activity of the sympathetic nervous system, which increases the release of norepinephrine. And in addition to supporting the nervous system, norepinephrine slows down the functioning of the immune system. In addition, the endocrine glands reduce the immune system functioning when there's prolonged periods of stress because the release of corticosteroids is occurring. And when corticosteroids are released, that triggers an increase in cytokines, which lead to chronic inflammation. Behavioral changes also result when we are stressed. So stress can set into motion a whole series of behavioral changes. When we're stressed, we're more likely to get poor sleep. We don't eat as well as we normally do. We don't exercise as much. We may also engage in unhealthy lifestyle behaviors like smoking and drinking. All of these indirectly affect the immune system. Third, personality style. An individual's personality style, which can include their level of optimism, coping skills, and resilience, can help the person experience better immune system functioning, and that helps the individual be better prepared to fight off illness. And then finally, social support. People who have few social supports often feel lonely and often tend to have poor immune functioning when they're faced with stress than people who do have a strong support system. And studies have shown that support from a social support system and having affiliation to others can actually protect people from stress and poor immune system functioning. Now let's take a look at psychological treatments for physical disorders. What I have listed here are the most common types of interventions. These include relaxation training, where people learn how to train their muscles to relax at will, and sometimes this reduces feelings of anxiety. Oftentimes, relaxation training is used to help prevent or as part of the treatment for medical illnesses that are related with stress. So it can be used in conjunction with medications in the treatment of high blood pressure. And it's also used to treat some of the other traditional disorders like headaches, insomnia, asthma, and so forth. Second, we have biofeedback. Patients who receive biofeedback training are connected to some sort of technology or machine that gives them continuous readings about their involuntary bodily activities. So I have a picture up here of what something may look like. Now this was just a clip art that I grabbed, but sometimes people will put these sensors on their fingers, and you can learn to control the temperature in your fingers by visualizing the increase of blood flow. So the monitor would show the temperature as it's going up to give you that type of feedback. So biofeedback is very helpful in the treatment of anxiety disorders, and it has been used to treat headaches and other muscular disabilities caused by strokes or accidents. Meditation is the third one. Now, meditation has been practiced since ancient times, but Western healthcare professionals only recently have been starting to take a look at its effectiveness in relieving physical distress. So the technique of meditation involves turning one's concentration inward and achieving some sort of changed state of consciousness. So meditation can also be used not only to treat these disorders, but to manage pain as well. Fourth one on here is hypnosis. And individuals who undergo hypnosis are guided into a sleep-like suggestible state during which they can be directed to act in different ways or to forget remembered events. Now, with hypnosis, the individual has to be open to using it. It does not work for everybody. And there are cases where the individual can be trained to do self-hypnosis. This technique does seem to be helpful in pain control, but they're also looking at using it to treat problems with certain skin diseases and rashes, as well as asthma, insomnia, high blood pressure, and other types of infections. Next, we have cognitive interventions. Sometimes when people have physical ailments, they can be taught new cognitive thoughts as part of treatment. So one example is something that is known as stress inoculation training. And in this type of training, patients are taught how to rid themselves of negative self-statements and to replace them with coping self-statements. Then we have support groups. So support groups can also be very helpful, because they can, the participants can talk to each other about things that they've done to reduce their stress and kind of share what's worked for them. And then we also have that social support as well. And then finally, the last one up here is a combination of approaches. And actually, studies have found that using more than one psychological intervention is very effective. So there's a lot of options available for the treatment of individuals who have these disorders. So getting back to our essential question, hopefully it's something that you thought about. What resources can healthcare providers give clients in an attempt to reduce psychophysiological disorders? And to conclude today's lecture, we learned about illness anxiety disorder and the psychophysiological disorders. That concludes this presentation. Thank you for watching.